Basketball season is just around the corner. It's a very exciting time of year, especially here in the Commonwealth. And even though basketball is described as a non-contact sport, we all know it's a very physical game, and injuries are definitely a part of the game. I wanted to take a few minutes today to talk about some of the most common basketball injuries and their treatment. Probably the most common injury that I see from basketball is the ankle sprain. Ankle sprains occur when the ankle rolls to the side. This generally happens when a player is landing from a jump and comes down on another player's foot. The ankle rolls and the ligaments on the side of the ankle stretch or tear. The initial symptoms of an ankle sprain are pain and swelling. Sometimes bearing weight is difficult and crutches may be necessary. Severe sprains like this may need x-rays to rule out a fracture in the ankle or the foot. The initial treatment for most sprains is RICE therapy, R-I-C-E, which stands for rest, ice, compression, and elevation. This treatment helps reduce the swelling and the inflammation, as well as the pain, to get you back moving as quickly as possible. Anti-inflammatory medications can also help to, again, reduce the swelling and the pain that comes along with these ankle sprains. Once the pain and swelling subsides, exercises are started to restore the strength and the mobility of the ankle joint. Sometimes severe sprains need a physical therapist to become involved to help guide these exercises. Proper rehab is essential in minimizing your risk of future ankle sprains. Before returning to play, especially with a more severe sprain, I generally recommend some type of low-profile ankle brace to help reduce the risk of re-injury, especially in the first 6 to 12 months following a severe injury. Now, while ankle sprains are the most common acute injury that I see in basketball, overuse injuries are also very common. And the most common overuse injury that I see in basketball is patellar tendonitis, or most commonly called jumper's knee. This occurs from an overload or overuse of the patellar tendon, and it causes pain in the front of the knee, just below the kneecap. Initial treatment for this is similar to sprains in that we generally recommend ice, anti-inflammatory medications, and rest. Sometimes an orthotic device that's a small padded strap that can be worn over the patellar tendon may help reduce the symptoms and let you get through the season. As with most overuse injuries, probably the best treatment is rest, but sometimes during the season we all know that can be difficult. Not all of these basketball injuries are going to require medical treatment, but the lingering injuries that just will not go away, or the progressive injuries where the pain gets worse and worse as the season goes by, are the ones that are going to need medical attention. And you may need to see an orthopedist or even a physical therapist to help you make it through the season. So while I know that your jump shot or your ball handling skills may be at the top of your priority list, remember that staying healthy is a part of the game. You can't stuff the stat sheet if you're sitting on the bench with an injury.